Hi, I'm Dr. Schwartz, and this is my channel. Welcome. Okay, so it's the first day of preschool, and your essentially normal little child is excited to go, and you skip off to preschool in your new outfit with your new lunchbox, and everybody's happy, everybody's excited, and you get there, and what happens? Your kid won't talk to anybody. Nobody. Not the teacher, not the other kids, not the lunch aide, nobody. You peel your child off of you. The teacher tells you that he's absolutely sure your child will be fine by the end of the day. You get back at the end of the day and everything is not fine. Your child did not say one word all day, not one word. Next day, repeat. Next day, repeat. This goes on for an abnormally long period of time until you have a teacher-parent conference, and it is strongly recommended to you that you seek some sort of professional help. This is not an uncommon scenario. It happens, and today we're going to talk about what you should do. We're going to start that right now. So what we're talking about is selective mutism. And the first question is, what is it? What is selective mutism? So there are multiple criteria for the formal diagnosis of selective mutism. Those are the criteria the doctors use in order to make the diagnosis, and they are as follows. A consistent failure to speak in specific social situations in which there is an expectation for speaking, despite speaking in other situations. The next criteria is that the disturbance interferes with educational or occupational achievement or with social communication, and this is really important. Sometimes kids will be very shy, and they might not talk for a brief period of time, say in the first week or a couple of weeks at school or at a new school, something like that, and that's not necessarily significantly problematic. And so the disturbance really needs to have a significant impact on educational or occupational achievement or interfere with friendships and social interaction. The third criteria is duration. The disturbance lasts at least a month, and it's in particular not limited to the first month of school. Fourth criteria applies to children who are speaking English or whatever the language is as a second language or not as a primary language. So it's very important to make sure that it's simply that they're not uncomfortable with whatever the spoken language is. And finally, that the problem is not due to another condition. There are a lot of other conditions that look like selective mutism but are not. What does it really look like to a parent? And so here are some of the really clear signs that you might see if you're the parent of a young child who has selective mutism. Often will avoid eye contact, especially when they're trying not to talk to someone who makes them nervous. They appear very nervous and socially awkward. They might even appear rude or sulky, very withdrawn and extremely clingy. They might be stiff, tense, or even seem kind of poorly coordinated. They might get aggressive. They might have tantrums, especially children who are forced to go to school or to interact, maybe in social situations, birthday parties, family events, in which they're extremely uncomfortable. You have to remember that this is almost like a phobia. They're really afraid, and they may respond physically with physical aggression. Some facts to know about selective mutism. It generally begins in early childhood, sometimes as young as 2 or 4. When it's left untreated, it will generally persist into adolescence, even adulthood, and get worse. It can lead to very severe problems socially and occupationally. The expectation to talk to certain people or in certain situations can trigger a freeze response that is sometimes can be really obvious to an observer. One of the most curious aspects, and I know I've mentioned this a couple of times, but it's really important, is that children with selective mutism, that word selective is really important. They can speak freely and very comfortably in specific situations, and that can be confounding to family and make it seem as though it's behavioral and lead to punishments, which are really counterproductive and very harmful. Selective mutism affects about 1 in 140 young children. So what are the causes? Why does this happen? There are probably multiple causes. It's generally accepted that selective mutism is an anxiety disorder. It's a type of phobia, certainly in the anxiety disorders family. It is an actual fear of speaking when there is an expectation to speak. It is associated with anxiety in general. These children are very anxious children. Some of these children have trouble processing sensory information, such as loud noises, and they may actually have something called a sensory integration dysfunction. Some children have experienced trauma and they may have other symptoms associated with post-traumatic stress disorder. Let's talk for a moment about treatment options. I think one of the most important things to remember I've already touched on, which is that punishment does not work. Tricking children into talking does not work and in fact is counterproductive and really can be very harmful. Treatment alternatives have been really well studied and generally accepted are several types of therapy, including cognitive behavioral therapy, family therapy, and play therapy, and then school-based and community-based interventions, which include behavioral type interventions and interventions aimed at reducing anxiety and then teaching various coping skills that help children to deal with the feelings that come up when they're confronted with these anxiety-provoking situations. Finally, medications that are aimed at anxiety reduction, which generally include the serotonin type medications, so SSRIs, such as paroxetine, for example, can also be beneficial. It is really important that treatment is never directed at forcing a child to talk. In fact, in general, treatment should never be wholly focused on the idea of talking. Instead, it should really be focused on of introducing the feared situations using nonverbal communication, nodding and pointing while calming a child down. This is the way that professionals that are using something called desensitization and exposure, this is the way that they work with kids who have selective mutism. Treatment should also address other issues that might be going on. Lots of kids who have selective mutism also struggle with separation anxiety, social anxiety, sometimes obsessive compulsive symptoms, and often speech and language problems, and all of these need to be addressed. In addition, children should be evaluated for other types of therapies and the appropriateness of those. Therapists can use muscle relaxation and facial expression charts to help children to identify their feelings. The important point here is that although selective mutism untreated can evolve and escalate and create a lot of problems, treated, it has a very good prognosis and children do quite well. There are many resources out there that can be helpful. I have listed in this slide just a few of the resources available. The Selective Mutism Association has a lot of information on its website and some pamphlets. And then these two organizations also provide information for families. Thank you for listening all the way to the end. And if you enjoyed this video, please remember to like it and subscribe.